from the station that's on your side. This is Channel 7 News Daybreak.
The time now 6:23. Most everyone has experienced heartburn at some point. It's commonly referred to as GERD. That stands for gastroesophageal reflux disease. In fact, more than 15 million Americans experience the symptoms each day. Joining us this morning with advice on how to deal with it, Baptist Health Dr. David Gerson with Sherwood Family Medical Center. Thank you so much for coming in.
My pleasure.
Commonly referred to amongst medical professionals maybe as GERD. Amongst everyone else, it's just I got heartburn.
Yes.
I feel like there is a fire burning in my heart, and it's not a good kind.
Yep,
yes.
absolutely.
So what is it?
Well, to put it quite simply, and it comes usually from overindulgence, smoking, eating too much, and lots of taking anti-inflammatories like ibuprofen and Motrin, those kinds of things.
Those causes.
Those are the causes. That's kind of the primary cause. But it's acid. It's just acid that is overwhelming the system.
Okay.
Very often, because of our overindulgence, the little valve between this part of our esophagus and our stomach kind of becomes incompetent, it loosens up, and so that acid comes up into the esophagus, and so you get that sensation, that burning sensation that you're eating fire. And that can lead to things like peptic ulcer disease, ulcers.
More serious
stuff, later on.
What about infections? Any infections?
Well,
yeah,
absolutely. So it's something called Helicobacter pylori or H. pylori you'll see, and it's a very common infection, and it doesn't necessarily, not everyone that has the infection gets reflux, but people with reflux very often have it, and by treating it, that can actually reduce or even resolve the symptoms altogether.
Let's talk about those treatment options out there. Let's start for something just like GERD, just heartburn itself early on before we get into more serious.
So and someone comes into my office, they're having the symptoms that usually have been having the symptoms for several weeks, so we're very aggressive. We go with usually what's called a proton pump inhibitor. You've seen the ads for the purple pill, not the blue pill, the little purple pill, like Nexium and Prilosec and those kinds of things. And we'll do that for about a month or two just to kind of get that environment to kind of calm down. Once those symptoms are controlled, we'll then step down to something like Zantac or Pepcid, which you can get over the counter.
Sure.
And then after that, as long as you don't have symptoms, occasionally if you've had a little too much turkey dinner or a little too much partying, one evening, you'll do Rolaids or Tums or that kind of thing. The big thing we want to do is kind of also prevent additional damage while we're treating you. And so you want to avoid the four main triggers, which are interestingly not, everyone thinks it's just spicy food. It's not. Yeah. Believe it, it's alcohol, mint, chocolate, which I know is a big problem for some folks, and caffeine. Okay. Those are the four main triggers that make that valve incompetent. The other thing we want to do, make sure, is that people aren't eating and then going right to bed. So after you eat, you want to stay upright for about 3 hours. So you eat dinner at 6, don't lie down till 9, because that acid will start just kind of bubbling up. And lastly, we try to get you to raise your head of your bed. Getting a brick, at Lowe's or Home Depot and raising that head of your bed just about 2 inches, it's enough to keep that acid down and not make you feel like you're in a spaceship, kind of.
Or sleeping upright, like that. Okay, interesting. Exactly. Well, some great advice this morning as always, Dr. Gerson. Thanks for coming in from the Sherwood Family Medical Center. If you would like to contact the Baptist Health Helpline, the number is on your screen.